Krish Gundu.
Good morning. Krish, co-founder and director of Texas Jail Project. We're back in May, Mental Health Month, back to paying lip service to mental health. But I wanted to share one story that on which a lawsuit has been filed this week. The other headlines, the national headlines on this story from Texas are much worse. It says, jail staff laughed at dying veteran left strapped to chair in Texas, lawsuit says. That's the other headline from the national news. So this young man, Glenn Smallwood, there was an emergency detention warrant out for him, but they let him out of the hospital. He was arrested on public intoxication, and in jail, within hours, he was restrained and threw up, and he was bleeding, and they let him die. That is the level of care that we're providing to people, to veterans in our jails. Again, the headline from the national news is jail staff laughed at dying veteran left strapped to chair in Texas, lawsuit says. And I want to echo something that my colleague just talked about. In the competency restoration audit that came out last legislative session through Senate Bill 1677, we had 15,652 people being put on the wait list. Over 10% of them came back on the wait list for new offenses. That's your revolving door. 54 individuals died while waiting for a state hospital bed. 2/3 of the state hospital admission now comes from jails. So 10 years ago, our state hospitals used to be your public mental health safety system. Now they're acute care. They're all forensic now. 2/3 are forensic. The other really scary piece of data from the audit report is that 341 people were placed on the wait list multiple times on the same charge, which means they kept coming back on the same charge on the wait list, which is a huge waste of resources. And then the other piece of information is that when they leave the jail, they are not provided with continuity of care. And then the whole report is completely silent on what happens when people have emergency detentions, which is what Mr. Glenn Smallwood had. We have people going into jails over and over and over again with emergency detentions, and no way for that data to be fed into the CCQ system. So I want to echo again what my colleague said. We are in yet another legislative session with no meaningful change for the mental health crisis in our jails, and this agency could be collecting valuable data to inform and educate the legislators. Thank you.